Welcome everybody to our first meeting of the year as the MSSNY RFS, and also with an advocacy action item at the end of this meeting. So excited you all could join us. I know the invitation was a little last minute, so I'm really glad you could make it. Next slide. And hi, I'm Kylie. I'm the treasurer. Sorry, I can't even say the title. For our MSSNY RFS, and we have a couple of other members here. If you all want to introduce yourself, would love to have you.
Hi, I'm Anna Heffern. I'm your RFS MSSNY counselor. So I sit on the MSSNY council that helps make advocacy decisions for MSSNY and other decisions during the non-council period.
Hey, this is Mustafa. I'm the vice chair of the governing council for MSSNY for their RFS section.
And then we also have our chair, who's Kareem, and that rounds out our governing council. Sorry for the noise in the background. I'm actually on my hospital campus, and there's a helicopter coming in. Yeah, I hope you can still hear me. It'll be over in like a second. But we in our governing council are here to support you all in MSSNY and to help guide our section and participation as a whole. And we're here to be a resource for you about how to get more involved. So that's what this first part of the meeting is about too. What is MSSNY? It's the Medical Society of the State of New York. And our mission statement is to advance the health of residents of our state by promoting a favorable environment for medicine through advocacy, education, and professional community for New York State physicians, which includes us as resident fellows. And then to also improve the health and well-being of our community through promoting wellness, fostering collaborative relationships, providing personal and professional development of physicians, and engaging in healthcare advocacy, part of which we'll be doing during this meeting. Aside from all the advocacy stuff and support we're going to talk about, there's also some financial benefits that I wanted to highlight here. And then there's more on our website as well if you just search benefits of MSSNY membership. But if you are looking for insurance because you just moved for residency or just moved for fellowship, there's discounted insurance for disability, home, auto. Also have, if you're just finishing residency and looking for your first job, there's employment contract review support. And then if you ever need an attorney for a little bit, there's legal services. You can get some free attorneys as well. And then also like just some discounts on travel, dining, hotels, rental cars, Broadway, if you're in the city, and more. And then, of course, if you come to our events, you meet people from across the state in different specialty societies and different levels of training, people who have been around for a long time, people who are new to the state. And then I think the most important part of getting involved in MSSNY is the advocacy opportunities, which we'll get to in a minute. But some of the ways to get involved are here. This is a sneak peek at our calendar for the year. So if you're not already in the GroupMe, if you did not find out about this meeting through the GroupMe, you're like, what is the GroupMe? We have a couple of different ways to communicate throughout the year besides email. So we have our MSSNY RFS GroupMe, which is just us as resident fellows. And then we have our MSSNY YPS RFS MSS GroupMe. That is for medical students, is the medical MSS part. RFS, that's us, residents and fellows section. And then the YPS is young physician section, who are people who have just graduated from the RFS and are in the first part of their career. So these are a couple of different groups where we talk about different advocacy opportunities and how to get involved and networking. So please join these if you haven't already. There are lots of ways to be involved through MSSNY. One of them, if you want to be involved in MSSNY as a whole, so be on committees, which are kind of the subject matter expertise for our state society. If you want to be a part of one of these committees, these will be with physicians in MSSNY as well as resident fellow representative or medical student, and they meet throughout the year, and you get to really meet people who are, again, have this networking opportunity, people across their career, across different specialties, across the state, to serve in this leadership role. And so if you're looking for things for your CV for fellowship or just would love to be involved in that and excited about that, the deadline is starting to come up. It'll be in September 1st is when the application will go out. And then on the 30th is the deadline. Then there's also a lot of ways to get involved throughout the year besides this as a committee. So we as MSSNY have representation in our AMA, which is the American Medical Association. Both we as MSSNY and the AMA create policy and craft policy and put that forward. These policies help guide our advocacy efforts and help guide how we spend our time and money and resources in the state capitol for MSSNY and then in Washington, D.C. for the AMA to help get things done. All of these policies are written by our members, so any member. So if you're new and you're excited and you have an idea that you'd like to see either MSSNY or the AMA take action on, the policy process is part of the way to do that. So MSSNY can bring policies through the AMA, and then us as resident fellows can also bring it through our resident fellow section through the AMA as well, if we want to do something on a federal level. So the AMA interim meeting is one of these policy meetings. There's 2 a year, one in November, which is the interim one, and one in June, which is the EAL one. The interim one is starting to come up. If you are available and excited and want to do policy stuff, we have so many seats available for New York MSSNY members to be a part of the RFS, which is the resident fellow section at the AMA interim meeting. That's going to be in National Harbor in DC. The first day, November 14th, is the resident fellow section meeting, and then the rest of it is the whole House of Delegates, which is the whole AMA as a whole, residents, fellows, medical students, physicians from across the country. We here within the MSSNY RFS, we're going to work on policy review ourselves to help give you the support to write these policies if you're excited about guiding MSSNY or AMA in a policy direction. So later in the year, in February, we'll start doing policy review and resolution writing for our MSSNY House of Delegates, which is our state society meeting. It'll be in Rochester this year in March. Well, we will debate and talk about all of the policies that have been proposed by people from across MSSNY and decide what becomes our policy and what doesn't. At this meeting, we're also going to have a joint meeting with our MSS, RFS, and YPS. Super excited about that, something we're doing for the first time. And then around this time of year, there's also going to be an advocacy day in Albany. So if you want to be the person who goes and talks with our state representatives to try and get things passed that will benefit us as residents, will benefit our patients, will benefit us in our future career, this is your opportunity to have that face-to-face time and also get some training in how to be able to do this and some practice. And then that brings us to our AMA annual meeting, which is going to be in June, which we kind of already talked about what happens there when we talked about the interim meeting. We're also going to have info sessions throughout the year. There's one coming up in September, October, November, which is by one of our partners, Milmic, Beyond the Bedside presentation. So things like contract review and things you need to know as a resident, besides just, how to be a resident and how to do medicine. All right, next slide. Okay, so now we're kind of going to transition in towards our advocacy part, our phone banking part of this session. So we're going to talk about Medicaid. One of the ways I wanted to just highlight is that we're able to do this is because we have policy on this as MSSNY, and this policy is written by our members. So if you're excited about writing something like this, come to our policy review sessions. But this is our policy that just recently got passed at our 2025 House of Delegates, which was in March, April of this past year. So this is MSSNY strongly supports maintaining and expanding Medicaid coverage to ensure access to comprehensive health care for vulnerable populations, and opposes any state or federal efforts to impose work requirements as a condition of Medicaid eligibility, and opposes increasing cost-sharing requirements for Medicaid enrollees. And then MSSNY will ask the AMA to make preservation of federal funding and eligibility for Medicaid an urgent and top legislative advocacy priority, and will ask the AMA to strongly oppose federal and state efforts to restrict eligibility and funding for all public health insurance programs, including Medicaid and CHIP. So we, as MSSNY members, are going to actively do this right now.
All right, and I'm going to take just a couple minutes. I'd said I would post